The other thing we do in the same office where we receive the patient is to conduct all the medical tests that we can do in a regular office, such as blood tests, ECG, that are usually conducted in a general central laboratory with people waiting for hours. They get there at 8 in the morning and then they queue and they get the blood test. So if we can, we do that in our own office and we prevent them going to different places. If there is a person that, because of their medical condition, would need repeated analysis, then we may start a program of habituation, but usually it's just, the professionality of the nurses and the personnel there that makes it possible to do it easily. After we have seen the patient, then we decide which specialties may need to see this patient, and we organize the follow-up in our program. If there are not special needs, we may follow them up every 6 months or 12 months, but we will refer them to specialties and accompany them to all of them. So where is this placed? This is placed in Spain, which has a national health system, which means that healthcare is provided by the state, is universal, is free, is tax paid, including all services, professionals, and medication. And the program is established in Madrid, which has a population of around 6 million people. We have no idea of how many ASD persons may be in the region of Madrid. We can make estimates, very rough estimates, following the National Statistics Registry, which says that in Madrid there are like 800,000 persons between 4 to 19 years. If we follow the prevalence rates of these, just for an example, being a bit conservative now, we would say that 6,000 adolescents or children and adolescents in Madrid could be diagnosed with an ASD, but we really don't have any direct data. So the program is really based on 2 offices that are communicated and that have a nurse coordinator, which is really the pivotal person in the program, is the most important person there. And then we have 3 part-time psychiatrists, one of them medical coordinator, 1 psychologist, and 1 nursing aide. But apart from this, we have the whole of the hospital. This is set up in a general hospital where we have all possible pediatric specialties and adult specialties. So the program uses the services of all these specialties for this population. The program is set up in the Department of Psychiatry, but it could be set up in any department. It could be in internal medicine, in general medicine, in neurology, and then you would refer more to psychiatry maybe, but less to general or internal medicine. It's just for local reasons that it is based there because the families decided where they wanted it to be placed and with which professionals. So it is based there, and it is in the adolescent unit. Again, the same. We attend 0 to 100 years of age persons, but it is in the adolescent unit just because of contextual reasons. This unit is quite a big unit with research, medical care, and teaching. And we have outpatient, we have inpatient unit. We are specialized in psychotic disorders and ASD disorders, and we have various areas of interest of clinical care and research. So the AMITEA, which is the name of the program, is in the outpatient clinics of the adolescent unit in this general hospital. What have we done in this 1 year and a half in which the program has been going on? So we have attended 513 new patients with many more visits. We have the proportion males to females, which is usually stated in general population studies for this population, so it's 80% of them are males. And most of the patients come before they are 18 years old. These are the age ranges. So you see we have less adults. The total program activity, we've had 12 admissions, 1,500 psychiatric visits in these 18 months, 1,000 roughly medical visits, medical tests, around 350. So it was really something that seems it was really needed. New visits and follow-ups. In blue, we have the new visits. That's more or less stable, and that is regulated by how we open the agenda or not. And reviews is coming up, except for the holidays periods. Which medical specialties we have needed most during this 1 year and a half? Some were what we thought we would be needing, but some were not. Mostly neuropediatrics, that for all to complete medical assessments, which we thought they were not complete, for instance, to follow up seizures and any other neurological problem. Then we have nutrition. We have incorporated a nutritionist to our program, and she comes every week now to assess mainly feeding problems, fats, obesity, low weight, different diets, restricted diets that people is following, supplementary treatments. So make a bit of rational approach to what families are doing. So they are asking a lot for this. Also ophthalmology, our intention is that all the persons that come through the program have at least one assessment in ophthalmology. Sometimes they haven't had any. So we have bought some material to make it easier. We have used a lot of gastroenterology also, and orthopedics and trauma, and these are the whole specialties. Also dermatology, neurology, endocrinology, so many of those. And these are the medical tests that we have conducted. Regular blood tests is in 80 of the cases, then ECG in 60 of the cases, genetic metabolic blood tests, X-rays, anesthesias, MRIs, so everything that you can do in a general hospital. We also try to make the use of all the tools that are available in different settings for this population. So we use pictograms, we use pictures, we try to give the families, these are the psychiatrists that work there. So we try that the persons that are coming to the program know us by photo or picture before they come. They know where they are going, the instruments that they will be using for them. So we try to anticipate and to help them with that. Also now we want to introduce some tools using the new technologies. There's a foundation in Spain which is developing very good material and tools for this, and we would like to implement that in our program and use these kind of devices for waiting time, to explain where they are going, the people and the office they will see, and all that thing. In terms of if this is efficacious or not, we have been awarded a grant last year to assess this, and we are doing a series of questionnaires in 2 regions of Spain, so in Asturias, in Seville, and Madrid. In these 2 other places that don't have such a program, they don't have any special medical program for this population, we have started this one, so we will be comparing baseline and 1 year later if there is any change, if people is more satisfied, is better attended, their medical needs are better accounted for. So what we are doing, if this goes forward. So just a series of questionnaires for families where we evaluate their health status when they came and 1 year afterwards, the use of services, the expenses, satisfactions, stress, questionnaires for professionals, for other specialties, to assess if their knowledge about this ASD disorders has increased in the year, because we do a lot of teaching and accompanying of people. And in conclusion, what I have to say is that Amitea, what it provides is a professional service that coordinates, channels and centralizes all medical information. We adjust appointments to family needs and availability. We accompany families to all their medical appointments. So they always go with a case manager, with a nurse to the different specialties. The nurse explains the specialist who is going to receive the patient, what kind of person is coming in, which are the problems associated with that person, which communication particularities he or she has. And we explain the family where they are going, the processes that will be going on, and we do all the administrative work for them. Our case manager does that. They don't have to go to different places. We try that families have several tests and appointments in the same day, always first and in the morning or when it's convenient for them, so they don't have to wait. They have to stay in the best possible place in the service they go. So we organize assessments, tests, appointments in the family convenience. We facilitate all administrative arrangements, which is really a very good help in a huge national system as the one we have. We reduce all waiting times, so we don't allow that one of these persons is without eating until 1 o'clock when they get a surgery, a minor surgery. So they always get this kind of procedures first time in the morning. And we accompany the families to all specialties and places. The other thing that it permits us is to increase the quality of the care that different specialists give to this population, establishing evidence-based or expert consensus-derived protocols. For instance, if, we try to be updated in what different expert consensus say about, for instance, what is the reasonable examination, physical and neurological examination for these kids, for instance, when they first come to the hospital. And we establish working documents to see, in cases of dysmorphic features, mental retardation, or what we would always ensure that the patient has been done a genetic assessment or MRI or whatever. So we establish protocols for the different specialties to try to do a good practice. And we just follow what the many guidelines that are around establishing which should be the adaptations of the health services for this population. So we just follow these available guidelines, and we are trying to establish our own protocols for each of the specialties, for emergency room, for inpatients, for neurology, for ophthalmology, etc. The principles that have followed this program establishment, families have been involved from the beginning. This is something that they asked for, and they stated their needs and suggested the professionals and sites where they wanted this service to be provided. There is a collaborative work with family associations and educational systems, so we coordinate with them to know about the patient, about their needs, about the peculiarities. We're committed with up-to-date training, and we try to avoid duplication of effort and maximize efficient use of time always. So if someone is very happy with their allergologist in some other hospital, they don't need to come for everything to our hospital. So we only want to improve the medical care that they're taking. And this is the people that is working in this program, and I will be happy to get your questions later on. Thank you very much.
Thank you.